Okay. So let's go ahead and get started. Welcome to College and Career Night with Ignite Your Curiosity. My name is Paige Levrin. I'm District Counselor for College and Career. I'm going to go ahead and ask our guests to go ahead and turn on your video and your microphone at this time. Welcome to our guests. Thank you so much for being here tonight. What we're going to do this evening is ask you a few questions. We'd like our audience to also ask questions as they might come up. You can go down to the Q&A feature at the bottom of your screen and type in your questions there, and I'll read those off to our guests tonight, and they can answer those for you. But we want to start with some basic questions tonight. First of all, who are you, of course, and then also, what is your occupation? So Kendall, do you want to start us out?
Sure. My name is Kendall Leonard, and my occupation is occupational therapist.
Welcome. Jeff?
Hi, my name is Jeff Elms. I'm a prosthetist orthotist.
That's a big name. And Joseph?
My name is Joseph Castillo, and I'm a physical therapist.
Fantastic. I've been to physical therapists one too many times. So Joseph, why don't you start out and tell students, I mean, we've got a wide range of students tonight. We have from late elementary through high school. What does a physical therapist do?
All right, so physical therapist basically works on what we call kind of functional movement. So, and it's very broad. You could have physical therapy in a hospital setting, in a nurse facility setting, an outpatient setting. Then within that, you have some neuro specialties that kind of deal with Parkinson's, stroke patients, spinal cord injuries, and then you have more like your outpatient orthopedic clinic, and they deal a lot with orthopedic issues like total knees, total shoulders, sprains, kind of injuries. And we also work with trying to help people just get their movement back, whether that's throwing a ball or learning how to walk or learning how to walk with the prosthesis. So physical therapy is pretty broad. I think a lot of people kind of have the idea of the outpatient kind of clinic setting where you go and you sit on a ball or you're trying to rehab for some kind of sport, or the other thing is just being in the hospital and somebody walking with the walker. But yeah, so I worked 20 years in the field at Kuya Delta outpatient clinic, and I saw everything there. Now I'm working at COS, and I'm the program director for the physical therapy assistant program. So within physical therapy, you have some assistants that help, and then you also have some aides that help out too. And we work closely with occupational therapists and prosthetics or orthotics.
That's a perfect summary. Thank you so much. And that kind of leads into Jeff's realm because you brought up prosthesis. Jeff, so for our younger set, can you explain what prosthesis is and exactly what your world is made of and what you do?
You bet. So my world overlaps with Joseph's a lot. In fact, when I lived in Visalia, I worked a lot with Joseph and his team. It's been a while. Good to see you.
Good to see you too. I remember.
We do a lot of what he does, but we make devices that fit on the outside of a person's body. So while Joseph is teaching them and Kendall to a certain extent on how to use these devices and how to strengthen those muscles, we work with the physical therapist, the occupational therapist, and the doctors on determining what's needed to get this person to be more functional, to be able to walk again, or if they have their limbs, to be able to use an orthosis to be able to straighten their limb to where they can walk straight and supported and safely. So we design braces, we design artificial limbs, and we customize it to the patient's body, and we adjust it to where it's comfortable and to where it gets them back to where they can walk again or use their arms or hands again, whatever's needed regarding the condition that they're facing.
So when we see someone that's had a leg amputated, then they would come to your clinic to get a prosthesis to help them walk, correct? Or if
You
they need
bet.
a brace, custom-made brace, not just a drugstore version, they come to you for a custom-made that works for them.
Correct. So we make them in-house and make sure that it fits, make sure that it gets them walking the way that they need to. And then we turn them over to Joseph and Kendall so that they can teach them how to use it and how to use their muscles with it.
Perfect. So Kendall, that leads to you. What does an occupational therapist do?
So like Joseph said, there's many areas of physical therapy. There's also many areas of occupational therapy. There's, acute occupational therapy where you're in the acute care part of the hospital. You're seeing a patient post-surgery. You also see them in rehab. But occupational therapists also work with students with disabilities. So I've worked in the school setting for years. And within the last 5 years, I've worked with infants ages 0 to 3 that are developmentally delayed. They have a diagnosed disability or they're at high risk for developmental delay because they were born premature or without a limb. And so you're working on helping teach the family, and I coach a teacher as well on helping that child improve their skills. We call their skills needed for daily living and working. So we call it your activities of daily living. So it's learning how to get dressed. It's learning to feed yourself. In the school setting, it's learning to use scissors and write. So you're helping them do functional activities every day with their disability or with their missing limb, learning different techniques and strategies on how to function.
So I'm listening to all three of you, and I'm thinking all three occupations need lots of patience and lots of people skills. Yes. But I know it needs more than that. So the next area I'd like to delve into is what kind of education and training do you need to become a physical therapist or a occupational therapist, or in Jeff's world? So Jeff, why don't you start us out?
You bet. To be a prosthetist orthotist, it's a master's in orthotics and prosthetics. And it's a small field, it's a niche field, so there's not a lot of programs. I think there's about 8 throughout the United States that you can choose from.
Okay, so I'm thinking if you're going into this master's program, so for our audience, you go to school, you get your bachelor's degree, which takes 4 years, and then from there you apply to a master's program. And this master's program, is that 2 years or 3 years long?
It's a 2 years program.
And is there a specific bachelor's degree that you need to concentrate on in order to get into the master's program?
It's funny you ask that. You would think that you would need some kind of healthcare bachelor's, and you do for a lot of the prereqs that are required for the master's program. You will need your anatomy classes and things like that. But my favorite resident that I've ever had was an English graduate. So they got their bachelor's in English, but they had their prereqs and everything that was needed to get into the master's program.
So prerequisites, I mean, you don't have to name all of them, but I would think, like you said, anatomy, physiology, what else? Anatomy,
physiology, biology, medical terminology. Those are the ones I came off the top of my head.
Those sound like they'd all come into handy. Joseph, since you're at COS and it sounds like you're doing the physical therapy aid and also you're a physical therapist yourself, can you explain to us both avenues and what the education difference is on those pathways?
Sure. I'll start off with physical therapy. So I got my master's degree in physical therapy, and that was 20 years ago. I think I worked with, Kendall, did I work with you too? Yes.
You did, yes.
All right. Is that your little one?
It is, yes.
Awesome.
Say hi.
Hi. So physical therapy now is basically every program has gone to a doctorate program, and you need 4 years of getting basically your BS and something, your bachelor's degree. And most of them get it in science. The prereqs that you do need is a lot like what Jeff was saying. You need them in anatomy, a year of anatomy, a year of biology, a year of chemistry, a year of organic chemistry, I believe. Those are probably the main sciences that you need. And so once you get into the PT doctorate program, it's a 3-year program, but it's during the summer. So it's basically a 4-year program, but you're doing summers. So the 3 summers that you're working basically adds up to another school year. So you're looking at basically 4 years of doing your prereqs and getting your bachelor's, and then going into a doctorate program and being in a doctorate program for another 3 years. The PT assistant, so a PT then can treat patients, they can do evaluations. So they can get a new patient in and they could evaluate the patient and see what their deficits are, and then come up with a plan to treat those deficits or the needs that the patient has. A PT assistant is somebody that assists the physical therapist. And so that's a little bit different. So here at COS, we're not a private school, we're a community college. And so I think the average cost through our program is about $6,500. If you were to go to a private school, you're looking more at $30,000. So COS, I know, big difference there, huh? But the only prerequisites that you need to get into here are 1 semester of anatomy and 1 semester of physiology, and basically your GPA has to be 2.5 and above. But we take 28 students, and we have like 150 applicants. So basically you need to make sure you get no lower than an A- in any of those prerequisites. So then a PT assistant, it's an associate's degree. And so they can't do evaluations, they can treat patients, but the physical therapist has to write out the plan, has to write all the exercises, and then the PT assistant has to follow those. And so they're assisting, they can see patients, they can come up to a therapist and say, hey, I see this, can we change this or whatever. So a lot of communication that goes back and forth. I don't know if you're gonna ask about finances later or whatever, but you know, physical therapists, I think it's anywhere from 75,000 to 110,000 a year. PT assistants, I think, are somewhere between 60 and 70 or 80,000, something like that. I don't know if that fully explains it. Do you have more questions? I might have missed something there.
No, I think it introduces the idea, I mean, that there's more than one avenue. Just like if you were to become a physician, there's a physician's assistant. I mean, there's different options, and you need to find the one that fits your pathway the best. So I think the fact that they can know that they can be an aide or a physical therapist gives some different perspectives.
Well, let me just add this. So physical therapist, you need about 7 years of schooling. PT assistant, you could get your prereqs done probably in a year, and then the program's about 2 years. So in 3 years, you're out. And then there's a PT aide that helps, and that's basically just somebody that kind of helps keep things clean, and can do limited maybe exercises in the vision of and the supervision of or eyesight of a physical therapist, and that can be done right out of high school. We do here at COS have a PT aide class, so people that can come and get kind of certificate to kind of get them better into this field. It is pretty competitive. It's a field that a lot of people want to get into.
So grades are important.
Grades are important, yes. Here at COS, it's pretty nice because we've had some people that weren't ready for school and they got really bad grades, but we let them do one do-over. So there is grace.
That's always good to know. Kendall, how about you? What is the educational pathway for you?
So similar, so there's, I have my master's in occupational therapy, but I think a lot of OT programs are now requiring a doctorate. I have my bachelor's in psychology, but you can do a psychology or related science field, because I know a lot of OTs have like a kinesiology undergraduate degree. But like Jeff said, I remember one of my OT classmates, her undergraduate degree was in fashion, merchandise, and design, but she had the prerequisites for OT and decided to become an OT. And the prerequisites are similar. It's biology, it's medical terminology, it's anatomy and physiology. You also have to have a certain level of psychology classes and human development or lifespan classes as prerequisites. And just like Joseph was saying, there's also occupational therapy aides who assist the OTs, and there's occupational therapy assistants where they treat the patients. They can't do the evaluations, but they're followed by an OT. It's less schooling. And am I forgetting anything else? That's it.
Sounds like a good start.
Yeah.
Okay, so if I'm a student and I'm considering these occupations, it might be great to know, what does a typical day look like? Who'd like to go first?
I can go first. So with my job, it's very different. I work for the Tulare County Office of Education. And I'm the infant program, so I'm 0 to 3. So I actually go to families' homes throughout the entire county. I'm the only one for the county. And so my day is traveling, starts at 8, ends at 5. And I do my own scheduling, which is nice because I can flex my schedule around, but I have a set number of clients that I don't have to see, but I have to see in a month. So I have like 75 students that I have to see in a month. And so I just fit them in where I can throughout my day, and I travel from home to home. And then we have to do daily notes. If we're seeing the child for the first time, we're doing an assessment and have to write a report. And because I'm for the County Office of Education, we do what's called an IFSP, which is an individualized family service plan that follows the child and eventually will follow them into school if they need it. So my day is all over working with families throughout the county. It's busy, but very, very enjoyable.
Sounds very busy.
Yeah.
Sounds very, very busy. Jeff, what does your day look like?
We have schedules normally, and we also go from 8 to 5. So we have our own clinic, and we have schedules that could be anything from an evaluation of somebody needing either a prosthesis or a brace. And when we see them, we determine what's needed. We talk with them, what their plans are, what they want to do again out of life. And then we help design it. And then we take a mold of their leg at that appointment. Another type of appointment that we can do is a fitting. So we took a mold the last time. Since then, we actually have something to fit on them and teach them how to walk with it, whether it be a prosthesis or a brace. Another type of appointment can be what we call a delivery, where we actually fit them with the leg or the brace. And then finally, they can come in for adjustments. So if something's hurting or something's not feeling right, they come in and we adjust it and make it right. With every single one of those appointments, just like Kendall talked about, we have to do documentation. They have patient charts. We chart what we did and what's needed and when we're going to see them again. And then in between those appointments, we're back in the shop. So we always have a shop with a lot of tools. And that's what I like about this field is it is patient care, but it's also building stuff and playing around with stuff. So we're in the back hammering stuff together. We've got rivets back there. We've got big old band saws. We've got grinding machines where we can grind plastic or carbon fiber. So you get your hands dirty. When we take the molds of their legs or their arms or whatever we need to, we fill those molds with plaster. So we have a positive plaster model of their limb. And we're able to shape that in the way that we want to design the brace or the prosthesis. So there's a lot of fun to be had in between the patients. And, that's what we're doing from 8 to 5. And then after hours, if you want to continue to tinker around back there or catch up on paperwork, that's what we're doing. So it's a lot of fun.
I'm thinking of my middle child. He likes the hands-on. And for a lot of our kids, I mean, even with the physical therapy and occupational therapy, these aren't just sitting at the desk kind of jobs. You're actually moving around. You're physically doing something. You're not just sitting at the desk all day, but you get to and interact with a lot of people, move around. Every day seems different, which I think would appeal to a lot of people. Joseph, you've had the experience of being at the hospital setting, also a private setting as well?
I worked some per diem in a hospital setting. I've worked in an outpatient neuro clinic, and I've covered in orthopedic clinics. When I first started at Kuya Delta, I worked with neuro patients, wound patients, pretty much did everything. So yeah, very wide.
So when you're,
very wide.
I'm sorry.
Yeah, that's okay. I guess like a typical day, it depends whether you're an inpatient. You'll see if you're in an inpatient setting, you can see, I think 8 to 10 patients, you're like about spending 15, 30 minutes with them and then going on to the next patient. There's also home health where you see maybe 4 or 5 patients a day and you're driving all over the place. Some people really like that. There's an outpatient usually setting where sometimes you could be seeing 2 to 4 patients at one time. They all have different exercise kind of programs going on. And then where I was working at, more of the neuro clinic, these patients are more one-on-one because they have a lot of comorbidities, high blood pressure, histories of stroke or different things. So that's more one-on-one, just treating with them. Now, the thing I like about physical therapy, like you said, you don't stay still. I knew I couldn't stay still. So I had to get in something that I could move around. And then in school, I couldn't keep, I was always in trouble for speaking. So you get to spend a lot of time with your patients and get to learn and get to talk to them, and you don't get in trouble. So it's kind of a sweet deal there.
Okay, so you're leading into my next question. Favorite thing about your job and least favorite. So you like the social, you like moving around, you like the fact that you're not sitting at a desk all day. Anything else that are real favorites? And the opposite, what's your least favorite?
So in physical therapy, you have a lot of your own autonomy. You're kind of your own boss. You get to kind of manage yourself, manage the patients. Everywhere I've been, a lot of good coworkers. I mean, I can go on positives. So to me, I think it's a great field to get into, especially if you have ADD and you have to be moving all over the place and kind of managing different things at one time. Great. Probably the negative thing is the billing. There is a lot of billing that has to go on. So you have to treat, but then you have to justify to the insurance why you're doing it. And, so that's probably my last or least favorite thing is just the billing. And in this day and age, it seems like we're always getting more and more billing, and we get to spend less time with the patients, or it's more about trying to assess them all the time and not really being able to have the hands-on. That's where the PT assistants, I kind of like them. I'm like, man, they get to just spend their whole time with the patient. So they don't have to worry about all that evaluation and that other stuff. So a little difference there.
Nice. Kendall, how about you? What's your favorite thing and least favorite thing about your job?
So my favorite thing, of course, is the hands-on. I love working with my clients. I mean, I get to work with babies all day, so it's kind of fun. And I like that I can make an impact, maybe not necessarily on the child. They love it because they get, someone to play with, but also like the families or the parents. It could be something small, like their child learning a new skill, or a parent feeling relief from a day-to-day stressful activity because their child can now do something independently that I've taught, or help them like not have to feel like they have to do it for their child. Like, look, your child can do this. So I like having that impact on them. I also like that I can make an impact on a coworker. I do a lot of coaching. I have to coach teachers on what to do with their families and the little kids that they work with. And I like that the teachers get knowledge or ideas, or that I can help them with their treatment sessions. Least favorite part, I would have to say paperwork. There is a lot of paperwork and billing, like Joseph said, but also just not feeling like I'm good enough or know enough, like that I just am always like learning, and there's just not enough time that I, have to give to my families.
Yeah. Jeff, favorite and least favorite?
Favorite part of the job, when you think about going to the doctor, it's usually because you're sick or because you're hurt and you're not in a good place. By the time you've seen someone like me, all that bad is behind you, and it's only good that you're looking forward to. And so my favorite part is finally getting that prosthetic leg or arm on that person and seeing the joy in their face when they get to walking again, and all the hope and excitement that they have out of it. It's life-changing stuff, and it's really, really fun. It's really cool to deal with on a day-to-day basis. And just here's a story really quick. Sorry if you'll indulge me. On Friday last week, we had a young guy, 20 years old, had cancer in his upper body. And so he had his amputation done right here, right before the shoulder even begins. So it looked like it was concave up on his upper body. And so we fit him for the first time with a myoelectric prosthesis where it reads the muscles in his body and reacts accordingly. And, this poor kid, he's been dealing with cancer for the last 5 years. He's dealt with half of his upper body amputated. And to see him giggle while moving this prosthesis around with his body, there's nothing like it. Least favorite part of the job, we're going to sound like broken records, but Joseph and Kendall, it's the paperwork. It's harder and harder to get stuff paid for. And, you really got to have everything in line. And even when you do, they still say no half the time. So it's a battle. And you really got to be on top of your stuff. And that's why the schooling's important and the attention to details. So it's a game in and of itself. And yeah, it can be a challenge.
Well, everything everyone's saying, it just sounds like a very rewarding field for each of you. Helping people when they are in a bad spot and bringing them through that's got to be rewarding. Do you have advice for our students out there? I mean, if you were to walk this path again, what do you wish you knew when you were starting out? Joseph, you want to lead off?
Sure. And I think it was about 5 years ago, a report came out and physical therapy was in the top 3 as far as most rewarding careers. I'm sure that's for OT and kind of all that bunch together, orthotists too. I think pastors were number 1, and then it was like therapist or something like that. So that was kind of cool. What would I give advice? I guess for me, I was very goal orientated when I went into school and I knew what I wanted to do. I wish I would have taken a step back and taken probably more classes, a diversity of classes, and taken that opportunity to actually maybe learn other things that are interesting instead of just going straight for my, I don't think there's anything wrong with that, being really goal orientated. But looking back, I mean, now that I've been working for, I don't know, 22 years, I'm like, man, I could have took more time back there. It would have been nice to maybe do a exchange student somewhere else, maybe like in a different country. There's so much that you can do after high school and in college. Well, you can do some of that in high school too, but when you get into college, there's such a broad or so many opportunities that you could take advantage of. I wish I would have done that. As far as going into physical therapy, I think if you do, I think you can do some of this other stuff, but you got to make sure that you are studying hard and keeping those grades up, because it is very competitive. I think because it's so rewarding. There is so many people that are applying for these spots in these schools. So you really got to make sure that you kind of bring your A game.
I like your advice, Joseph, about take your time and take some broad classes and the exchange programs. I think sometimes when you're first starting out, when you're 18 or 19, you think you've got to rush through it. Like there's this finish line that you've got to hurry and cross. I think I would give the same advice. Slow it down and see the world around you in the process of.
I wish I would have taken coronary, or what do you call them? Coronary? Cooking classes?
Culinary?
Culinary,
Yes.
yeah. Maybe I could have been one of
Yeah.
these like YouTube guys or something like that on the Food Network or something, / physical therapist, cook. I don't know. I'm just saying, could have been.
You can start a whole new physical therapy with cooking. Jeff, how about you? Advice for students?
My advice is, yeah, take your studies seriously. And when you get into the latter parts of your studies, whether it be a grad school or into your major program, you don't get discouraged. There's going to be some really, really hard times. And you're going to look around and think that no one else is going through those hard times. Everybody is. You stay positive, you get through it, and then you get into the job field and it's the same thing. You're going to think that you can't do it, but you can. Everyone goes through it. And as long as you're positive and you want to do better and you show that you want to do better, you're going to succeed. And that's the way to do it.
That's perfect, Jeff. I think a lot of kids don't realize that other kids are struggling just along with them. And they give up because they think they're the only ones struggling. But if you had a wider perspective, you'd figure out everyone else is going through the same bumps and you're not alone. So great advice. Kendall, how about you? What's your advice to students?
I agree with everything that Jeff and Joseph said. Definitely. I knew that I wanted to be an OT since the 7th grade. My grandfather had a heart transplant and I just loved seeing like the relationship he built with his therapist while he went through his rehab. And financially, I thought, oh, college is so expensive. So I really rushed through it. And I really reflect back and wish I would have like taken more time to learn other things. But as far as like in the field of like maybe therapy, don't be afraid to try something new. or put yourself out there and ask to volunteer or do observation hours. There are so many areas that therapists work in. It's very broad. So it's good to like keep your eyes open to many areas. Cause I always thought I would be a rehab therapist forever. And I thought I would be in a rural small town because that's where I grew up. But now I live in a big city, even though most people don't consider Visalia big, it's big to me. And I work with children and I didn't think I ever would. So there's a lot out there. Definitely don't be afraid to try something new.
Great advice. I'd like to open this up so that we can have our students that are with us ask questions. So for our audience, at the bottom of your screen, you can see a Q&A. You can click on that and post your questions in that area, and I'll read them off to our guests. And as you're doing that, I'm going to throw out one other question to our guests, and that is, what do you like to do in your spare time? Anyone like to take that first?
So
Jeff,
I'm
how
actually
many-
I'm actually a physical therapist trained, but I'm also a pastor. So not just on weekends, that's through the whole week too, but on weekends get to preach a little bit, get to visit people. So it's kind of cool because I get to do the physical side of healing, but then get to do the spiritual kind of mental side of healing too. So I love it. Totally love it.
That's a great combination. So you're giving 7 days a week. What do you do to restore your sanity?
I love what I do. I love physical therapy and I love the ministry aspect. So I actually get charged from that. So if I start getting overwhelmed or I feel like I'm overdoing it, usually if I take a day off or whatever, then I'm ready to go back. So I actually get charged from my work. And then, like I think Jeff said too, I mean, you asked like, what was the favorite thing? And I did miss the most favorite thing is when you see the people happy when they get to walk again or stand again. I mean, you just see that and it's just like, it's just joy. So it feels good. So I don't know. I don't know if I'm really working or not. So maybe I should get back. I don't know.
That's the best job right there. When you say you're not working, that you're doing what you love, that there's a lot to be said for that. That's fantastic. Kendall, what do you do in your spare time?
I obviously have a little one that everyone has seen. So we do a lot of family time. She loves sea creatures and sea life. So we like to go to the beach. But also my husband and I are into fitness. We just swam from Alcatraz Island on Saturday to San Francisco. So we swim and run, and I like to read in my spare time.
Hi there. And Jeff, how about you? What do you like to do in your spare time? Because I know you've got a full household too.
We do. We have 4 kids. So I was going to say, what's free time? We are the opposite of Kendall. We are foodies. So we love to go out. We live in.
We're foodies too. That's why we work out.
Oh, good. I need that second half of it. We live in Houston, Texas now. So it's a big city with a lot of different things to go and see and eat and do. So we went to an Astros game the other night because it's down the street, and you know, a lot of fun things to do with the kids to keep them entertained, whether it's that or alligator parks or zoos or whatever the case is. So something always around the kids where we're having fun.
Nice. Enjoy every moment. And you do have 4 cuties there. I see Allie posting your pictures of those. Okay, so I'm still looking for questions from our audience. I don't see anything yet popping up. So we're about to go ahead and wind up the evening unless anyone from our audience has another question that they'd like to throw out for our guests. Okay, I'm not seeing anything pop up. That's okay. I want to thank our guests for being here tonight and taking time out of their busy schedules to share with our students. Thank you very much. And I want to thank our students and our parents for being here this evening. We did record this. Jeff and Joseph, I need to talk to you, make sure you're okay with me posting that. If we post this on YouTube, you're okay? Great. I already ran it by Kendall. So we will be posting this on YouTube for the College and Career YouTube page that we have. And so if you have other students or that you want to share this with, feel free to. And with that said, Kendall, Jeff, Joseph, thank you so much for all your time and your words of wisdom. And you guys have a great evening.
Thank you. It's my pleasure.
You're welcome.
Have a
Okay,
good night.
thank you. Take care. Bye.